Unlocking Nigeria's Healthcare Potential, the Need for Risk-Tolerant Financing. The Nigerian Economic Summit Group, NESG, has made a compelling plea for the implementation of risk-tolerant financing strategies to tackle persistent obstacles in healthcare access, quality, and facilities throughout the nation's urban and rural landscapes. During a significant pre-summit discussion held in Abuja, aptly titled Catalytic Capital for Healthcare, Bridging Nigeria's Systemic Gaps, NESG highlighted the crucial role of catalytic funding as a mechanism to engage private investors and foster novel financing methods that are essential for maintaining ongoing improvements in the health sector. This initiative is seen as a key part of the government's renewed effort to boost healthcare investments under the Presidential Initiatives for Unlocking the Healthcare Value Chain, PVAC, and the Nigeria Health Sector Renewal Investment Initiative, NHSRII. Dr. Maurice Atoki, who leads the NESG Health Policy Commission, emphasized the critical nature of forming strategic partnerships to achieve universal health coverage, UHC. However, she also pointed out significant challenges, such as the worrying trend of healthcare professionals leaving the country, brain drain, and the lack of investment in diagnostic capabilities, both of which severely hinder progress. Atoki passionately argued that having affordable, high-quality diagnostics is essential for early detection of illnesses, efficient treatment options, and improved health outcomes for patients. She stated, "Catalytic capital, crafted to mitigate initial risks, can facilitate investment, draw in private funding, and trigger vital changes throughout the entire healthcare value chain. This includes everything from primary care to infrastructure and even local manufacturing." In parallel, Dr. Richardson Ajayi portrayed Nigeria's private healthcare landscape as highly fragmented, predominantly characterized by individual practitioners. This fragmentation severely limits opportunities for larger-scale investment. He expressed concern over the low penetration of health insurance, pointing out that 70 to 80% of healthcare expenses are currently out of pocket. Moreover, he highlighted the unsustainable reliance on imports amid foreign exchange issues, emphasizing the urgent need for local manufacturing capabilities. Related news: experts warn poor leadership, weak social contract is hindering Nigeria's growth. Stakeholders are advocating for a harmonized pharmaceutical sector and improved healthcare systems. NESG announces its 31st Economic Summit, calling for innovative reforms. In her keynote presentation, Ms. Fola Lawiye, co-founder and CEO of Iwasan Investments Limited, underscored how risk-tolerant financing could invigorate sustainable engagement from the private sector. Lawiye shared insights into Nigeria's healthcare market, estimated to be worth around $40 trillion, $15 to $20 billion, forecasting a growth rate of 7 to 8% per year. Lawiye proposed that establishing an African health fund could lessen dependence on aid and recommended that 25% of health insurance funds should be allocated toward infrastructure improvements. She also called for creating a robust and sustainable capital foundation for the healthcare sector. During a panel discussion, Dr. Ayodele Cole-Benson, who leads the NESG's Health as a Business Initiative, explored strategies to enhance local medical manufacturing, reduce the need for imports, and encourage investment. Similarly, Ms. Olufunke Falade from the Nigeria Sovereign Investment Authority, NSIA, discussed efforts to provide active pharmaceutical ingredients, APIs, and other necessary excipients to support domestic drug manufacturers. Dr. Austin Okogan, CEO of the Lilly Hospital Group, elaborated on how the private sector could spearhead healthcare innovation in Nigeria. Mrs. Odunayo Sonia, Managing Director of the MTN Foundation, reiterated her organization's dedication to sustainable healthcare initiatives, referring to their role as a statement of faith in collaborative efforts aimed at enduring impact. She remarked that NTN's persistent investments in community health have laid the groundwork for partnerships with other corporate entities, thereby enhancing the advantages of catalytic capital. Attendees of the forum reached a consensus that fortifying Nigeria's healthcare system is not only a public health imperative, but also a crucial factor for developing human capital, driving economic productivity, and ensuring inclusive growth. What are your thoughts? Is risk-tolerant financing the answer for Nigeria's healthcare challenges, or do you believe a different approach should be taken? We would love to hear your views in the comments. And here's a thought to ponder. If local manufacturing is critical, what steps can be taken to expedite its development in Nigeria's healthcare sector?